Hello everyone, my name is Ryan Thompson from the Department of Medicine. I'm here today with Lauren Hanley from the Department of Obstetrics and Gynecology, as well as Dan Henderson from the Division of General Medicine and Primary Care. And we're doing two things today on continuity visits in the MGPO Continuity Visit Program. I'll let our colleagues here talk about these visits, but the program has been around for 6 or 7 years. It's a way for us to try to get our physicians into the hospital. It's an optional program to try to see their patients at a time when the patients feel vulnerable during a complicated, maybe scary hospital stay. Let me just start off by talking to Dan here with the question. So just why don't you tell our counterparts out there what a continuity visit is and why you make these visits?
Sure. Well, so there are a lot of misconceptions about what these are. The point of a continuity visit is not to oversee the management. It's not to second guess what the team is doing or anything like that. It's really just to convince your patient that you're aware that they're sick and in the hospital and that you know that and you're there for them. And usually I find that rather than talking about, the blood counts or the antibiotics, we're talking about much more kind of social things, and I'm just checking to see how they're feeling. I find that these are really valuable for two reasons. One, the patients come away really appreciating it, and I feel like they even trust me more after, even though I haven't really done anything. I've spent maybe 5-10 minutes chatting at the bedside. The other thing that I think helps is I saw them when they were sick, and so when I see them a week or two or 3 or 4 afterwards in the office for a follow-up or for whatever reason, I know what they looked like then, and there's something that the lab values and the discharge summary don't fully convey. So I love these, and they're pretty easy to make, and my patients love them too.
Just one quick follow-up question for you, Dan. So are these a consult, or are these really meant to be just a quick visit? I mean, how much time do you spend when you make these visits?
Yeah, great question. So they're definitely not a consult, and it's really just 5 to 10 minutes. I think of it as if your patient knows that you care about the fact they're in the hospital and they saw you visit them, that's enough. I'll drop a little note just saying that I saw them. It literally says, we discussed his or her hospital stay and feel free to page me with questions, but I don't go into a lot of detail about why they have this pneumonia, because that's not the point of these. It doesn't mean I don't sometimes talk with the team because I want to be helpful, but I don't feel like it's my place, and I feel like these give me a nice defined small package role to spend just 5 to 10 minutes interacting with a patient.
So thank you. So a question for Lauren. So we wanted to feature the OB-GYN department because they actually were making these visits as part of their department well before our program for continuity visits existed. It's been a real valued initiative there. Tell us how you guys view these visits within the OB-GYN department and how your patients feel when you visit them in the hospital.
Sure. So we work very much with the team approach in OB/GYN, and so very often we'll be caring for a woman in the office and seeing her very, very frequently, and she isn't admitted necessarily because she's sick, but she's obviously undergoing a birth or maybe admitted for a complication of the pregnancy. So stopping by and spending, again, a very short amount of time really shows how much we care and that the team works together. We're going to understand the discharge planning. We help process if it's a complicated birth and there are questions or issues going on surrounding the birth or perhaps a complication with the newborn. It's a really important time to be there for the patient and for the family to help them process. Again, it doesn't take very long, but just going into the room and helping the family and working on what the follow-up plans will be with respect to what the discharge plan will be, when you'll see them afterwards is really important for the family.
Great. So that's really fantastic. I guess one just last follow-on question is, how do you, we're talking a lot in healthcare in general and certainly in the MGPO around burden on our physicians, and we've talked about these visits are intended to be brief and targeted and not add a lot to your day. How do you feel as a busy doctor when you make these visits sort of about your work that day? Does it sort of add anything to you? How do you sort of feel about your work as a physician when you see your patients in the hospital?
Well, we get the email every morning, so we know which patients are in-house, so it makes it easy. And then I usually try to go either at the beginning of my day, in the middle or at the end of the day. And I try to just have a list in my mind or even written down if there's many patients of who I need to stop by and see. And I really think that just spending, again, 5 to 10 minutes goes a really long way. And it's really special for the patients, especially in OB, when they have a newborn baby, after we've seen them for so many visits through the last 9 months, to really share that moment with us. So it really actually gives me a lot of satisfaction in my day, and it's one of the highlights of my day.
That's great, and I guess the final word that comes to my mind is trust. I think that the trust we feel with our patients when we care for them longitudinally, or even if we cared for them on a prior admission and visit them on a readmission, if we're, say, for example, a hospital-based clinician, I think it can go a long ways, not only to help our patients and how they feel about their care, but also our own satisfaction when we're there for them in difficult moments. So that's a brief overview of continuity visits. We're going to have information in the text that accompanies this short video about how to make the visit, some of the mechanics, the documentation and billing, as well as a video that demonstrates how to document and bill for one of these. So thank you very much. We appreciate your watching this.